most of the training programs, you have to have a bachelor before you can apply. I was told that it was more than 500 people apply, but the programs accept, I think, 20. Happy New Year, everyone! As a surprise to bring in the new year and reaching the 10K subs milestone, Blood Talks will be releasing a brand new segment, Blood Talks Small Talk. I'm very happy to have been recruited by our creator, Peach, to help co-host this little talk show. I'm Mars. I'm an MLS certified by ASCP with 8 years of experience in the core lab under my belt. And now, without further ado, our lovely Peach, who has been supplying you with all the lab tips and tricks for the past 4 years, would like to talk a little bit more about what to expect from this segment. Hi, thank you, Mars, for introductions. Well, welcome all to Blood Talk Small Talk segment. I'm Peach, a licensed medical laboratory scientist certified by ASCP and the state of California. I started this channel because during my training years, I realized there was tons of resources for doctors and nurses, but there was really hard to find any resources for MLS professionals, especially when it comes to engaging and educational contents. I want to create a space where we could learn, connect, and maybe even have a little bit of fun along the way. So that's why I created the Blood Talks. All right, so let's jump right in. So what is an MLS? ASCP and almost internationally, they go by MLS, Medical Laboratory Scientist. We also have a couple of different titles. I believe around the world, they might go by medical technologists. But here in California, we're mostly known as clinical laboratory scientists. So from here on out, so that we don't get confused, we'll keep referring to ourselves as CLS. But basically, do you want to give a little bit explanation of what we do, Peach? Well, yeah. So CLS is the people who working on all the testings, like when you go to hospital, all these body fluids that was collected, whether it will be blood, urine, stool culture, biopsy specimens, like any bone marrows, spinal tap, spinal fluids, all kind of body fluids. Everything gets sent to laboratory, right? And then we're the one who doing the analysis on them, and then letting the doctor knows what is going on inside your body, so that they can they really know what or how to treat the patients, not just guessing. So without these numbers or the results from us, they'll be like, okay, the patient is having this symptom. I'm thinking it could be this disease. Let me guess, treat it with this one. So it's like a guessing game. I mean, of course, they have a lot of years of training, so it's like educational guess, right? But with this test results, it's more confirmed, like this is what the patient has. Like another good explanations, or maybe people will be more familiar, it's like when during COVID. So we're the one who doing all those COVID testing. So basically, we're just behind the scenes. You come in, you get your blood drawn, or you submit a urine sample, or sometimes you submit a stool sample. We are the ones who run the testing, analyze, supply the doctors or nurses with the information, and then they can correlate and treat from there. But one thing I wanted to add is not very many people know of our profession. And so actually, how did you become a CLS? Because my story is kind of oh. Actually, I'll tell you about my story. I wanted to add on to that is that it's true, not a lot of people know about CLS. I think a lot of people even thinking that either doctors or nurses who doing their testing, which is not true. They don't really know how to do any of these testing at all. Like a lot of doctor and nurses never actually step foot inside the lab. I would say most of them have no idea what's going on inside. They just be like, where's my result? I think so to branch off of that though, I used to think that the nurses also did it, because I think I went into urgent care one time
And I saw them run like a urine dipstick just to like confirm whether or not I had a UTI or yeah, like urine pregnancy and stuff like that. But anyways, so tangent, but so since our profession is not widely known, how did you come about becoming one? Or like how did you figure out this profession before pursuing?
Yeah, see, so I always wanted to work in labs. I always loved it. I actually have no idea that like CLS or MLS is even existed. I thought that anyone who graduates from like life science or can, just work in the lab, which I was doing that for years before I got my license. So like even though I only kind of licensed CLS for like almost 10 years now, but I was working in the lab for almost 20 years. Because like even like before that, because I always loved the lab, but it was more like a research lab or clinical lab. It's not like in a hospital, like, working on this as a CLS. And I think my last job before I'm becoming a CLS, I was so grateful of my old manager. She was a CLS, or she has her license, right? And then she was like recognizing, I guess, my talents, if I have any. So that she was like, "Oh, do you want to become a CLS?" I said like, "What is it?" Then she was saying like, "Well, what you're doing, um, then like what the results that like just the technicians are doing after we finish, we send it to her. She would review and then release the results, right?" And then she said, like, you are like, reviewing your like colleagues' works, kind of making sure everything's like the controls are in range, everything runs smoothly. Then she said, like, you can become a CLS if you are interested. So then I starting to look into the program. And then I was talking to her like, like with the program and the time that I'm working, it doesn't really work. Like the school, it's like in the middle of the day. Like I work from 8 to 4:30 or maybe 5 at the time. So she was very, very nice and the schedule was adjust. So I would go to work from 6 to 10. I go to school and then I come back to work again. So I would be the first one who opened the site, like I do the QC, I do all like the reagent, I check everything, prep everything for people. So once they come in, they working, I go to work, I go to school. So after school, I come back. So they finish their work. I'm the one who closing it, like make sure that all the reagents are put in, like doing that. So I was doing that for mm, I think maybe a year or 2 years. I don't remember. Once I have all the prerequisites for CLS program, then I'll apply for CLS school. Then yeah, after I finish the school, here I am. But actually, like to like go way back on my last year of school, I actually like heard about like CLS a little bit, like really briefly, and then I think it was just kind of like, oh, if you get CLS license, you can work in the lab. But then it wasn't like clear to me it's a different type of lab because I was thinking, well, I already got a job in a lab. I've been working in a lab. Why do I need to get a CLS license? So I never like really look into it or it wasn't like explained to me what's the difference between like having a license and not having a license, like the type of work. I was really fortunate to have her as my manager because I think I would still like may not make it here right now. So yeah, what about you? Like tell me a little bit like what bring you to become a CLS?
So I kind of like took a roundabout way, I think, into becoming a CLS. Um, I'm actually pretty fortunate that I stumbled upon it, but it took me a while. I was what you would say a super duper senior at my university undergraduate. So basically, I started as a completely different major, urban
Mm.
regional planning. Went through a year, figured out like, oh, dude, I hate this. It's not for
What is
me.
urban digital planning?
Urban regional planning is basically like if you think about the people who work for the city and then they design the layout and zoning of like
Oh,
residential
like
and like
residentials,
yeah versus commercial.
commercials.
Yeah. My parents worked for the housing industry, both of them, and so I was like, I'm gonna follow in their footsteps. Yeah, no, I don't like it. And so I wasn't sure what to major in, and then I was just like, oh, you know what? Like I like science in high school. Let me go into biology.
Mm.
I didn't really know what to do with it. I was just taking like classes that I was interested in. I really enjoyed neuroscience and neurobiology, so I thought, oh, maybe I'll pursue that and then do some lab work or research after I finish. And then I was like, this isn't really stable. I don't know what to do. And I think my mom and a couple of her friends were discussing, like, oh, how is Mars doing in school? Like, what is she taking? Oh, like she's taking bio, but she doesn't really know what to do after. And one of her friends is a CLS and like recommended to my mom, like, you should tell her to look into it. I did, and then I was like, you know what? Like, let me try it and see how it is, do more research. It sounded interesting because I was like, oh, a stable job where you actually still get to work in the lab, but you're not doing research and it's kind of a little bit routine, but not so monotonous. But I found out about CLS school and like or the profession at my last year of undergraduate.
So you
Um,
found it early.
uh, I I
Like,
I not super
yes.
duper early because I missed out on taking a bunch of the prerequisites. Like so we'll get into this later about how to become a CLS, but
Yeah.
most training programs they have like prerequisites, right? So it's like quantitative analysis chemistry, hematology, immunology, microbiology. Am I forgetting
Mm-hmm.
something? Yeah, so I wasted, not really wasted. I just took a lot of classes that I was interested mostly in for my undergraduate electives instead of the ones that were targeted towards like the prerequisites. And so I had to go back to school to take a bit more of the prerequisites before I could apply for the program. Um, but that's basically how I got there. But the process of getting into school, that's a whole different story. Do you want to talk about your experience or?
Well, like for me, since I didn't really get into it or know about it or even look into it until after I graduate. In fact, it's actually after, I think, 5 years after I graduated.
Oh, so
So that's why I said like you found it pretty
oh,
early.
did you
Because
have
like
to take the
after,
rest of the prerequisites after you graduated
yeah,
also?
that I was taking
Ah,
those when like, in between my work
oh, I
hours.
see. So
So
those were
like
the classes.
it's one of the classes that I missed. So then I would be doing that. There were some class that offer really late.
Hmm.
So then I would be finishing. I would go to work early, finish the shift early, and then go to school. So for those, I think 2 years, I was pretty much almost doing like a like double shift because I would start off my day at like 6 and then don't like end because the class doesn't end or either like the job like not ending until like 10 at night.
Such hard work.
I think I don't know how I did it at the time. Now that looking back, I'm like, that was a lot of hours. How did I manage to do it?
We
And
were
now I
much
feel like I'm
younger.
getting like older. Yeah, no, seriously, I'm like getting older and then I feel like, damn, 8 hours. When is this gonna be eight? Is it only 5 hours? It's so tiring.
It's
But
burnout for real.
yeah, but no, like really it's actually like a very fulfilling job. I'm really glad that I stumbled onto this path. It's very fulfilling. So, well, going back to like how we getting into the program. So there are at least like in like what in California, right? So that's why we're like kind of referring it to CLS because I think the rest of the world like referring to it as MLS, but
Yeah,
we
MLS
gotta
or
be
medical
special.
technologist.
Yeah, we
They
gotta
want
be
to
special.
show that we are clinical. I don't know why, but okay, go ahead.
Yeah. So there's a few ways. I think there are a few schools who actually offer a CLS degrees as a undergrad, like a major. Like Dominguez Hill is one of them. But that most of the school or most of the training programs, you have to have a bachelor before you can apply to become a CLS, like or a trainee in CLS program. And it's pretty quite competitive. Like in my year when I apply, they well, I was told I wasn't one of the admin who get all the applications, but I was told that it was more than 500 people apply, and but the programs accept I think 20 students.
Yeah. So we did the same. We did the training program through the same school, different hospitals, but also I did the year after you. But in my year, I don't remember how many people
Mm.
applied, but only 100 interviewed and 20 were accepted.
Oh
Um,
yeah, that's true. So like it was like a lot of like a different
yeah.
I guess screening level. So like the initial application, there was a lot. And then, but they only interviewing 100. No, you're right. I think the same thing as my year. So they cut down to 100 for interviewing. And then out of the 100, it's only like 20 students who get placed into a hospital. And it's not only that. I think once you get interview, um, it's the hospital. It's like a job
Oh yeah.
interview,
Yeah.
right? The hospital is like interviewing you, and it was scary. I don't know how was your experience. Like for me, I went in there and I felt like, what did I do wrong? I felt like I'm in a principal office or something because it's just like you, like just one, right? At the end of at the room,
Yeah,
and
and
then you
our
have like
program's a
20,
giant panel. Yeah.
30 people, like I guess like in a U shape that
Mhm.
what they're like sitting, and you're just like, what? Who do I look at when I talk? Because there's so many people in there. Yeah, it was
Um,
scary.
I guess I had like a different experience. So I applied to two different programs. One was at a private hospital where
Mm.
it's like they only have, I believe, 4 students. So they're not affiliated with any school. They only take 4 students per year, and all
Oh.
the lectures that they have are given by like doctors or other personnel on site for the different subjects that we study. So like for our school, the didactics were hematology, blood bank chemistry, and micro. Yeah. So those different subjects they just had lecture at the hospital.
Mm.
But for our program, I was actually very comfortable in the interview. One,
Really? Oh, that's good. That's
one,
good.
one reason being I had the other one under my belt already, so I kind of knew what to expect. Number two is I worked as a lab assistant at the same site in which I trained before I applied for the program. So
So you knew some of the
I
people?
knew some of the people. I knew the advisor for our site and I knew the program director 'cause she used to be the lab manager of our hospital. So I
Mm.
felt pretty comfortable, but yeah, I just kind of focused on mostly talking to them too, but Tony, the hematology, apparently she talked to one our Anthony, our friend, and was like, "Oh yeah, like I really liked her a lot." So I was just like,
Oh, that's good. That's
"Yeah."
cool.
But the program super competitive. I got very lucky to get in, but I think back in the day for us, it was a lot more competitive because not many hospitals, there were not enough training sites for
No.
the amount of people who wanted to go into the career. But
Yeah.
the program in which we're affiliated with, like the school we're affiliated with, they have like so many more sites now. I think the classes
Mm-hmm.
are
It's
around
expanding now.
like 50. They take 50 students now. I'm not sure. It's
For
definitely
sure.
a lot more. Maybe like 35, 40. It keeps growing every year. But yeah.
Well, just wanted to highlight that, right? The program keeps growing every year is because of their high demand for
Oh yeah.
CLSs. Yeah, so it's a
The
good time if you are thinking about becoming a CLS. So
I'm always trying to push it to like other people that I know, but the reason why they say we're gonna have a CLS shortage is because most of the baby boomer generation who's about to retire, they hold two jobs. So
yes,
when they all
yeah.
retire, like,
Like when
oh,
one retired, the actually two
yeah,
vacants.
two vacancies. So if you guys are looking for a stable career, highly recommend. Like, I,
Stable,
oh yeah, go ahead.
fulfilling.
Yeah.
Yeah, sorry, like
I I feel like I'm one of the only few people out of my friends who can say like, no, I really love my job. Like I love the work we do. It's very interesting.
yes,
I'm
yes.
always learning something new. Like if you're the type of person who always wants to learn new things or wants to know why, is fascinated with the human body, like 8 years into my career, I'm still learning things and it always like fascinates me. Especially with all of the new technology for like how testing is done or basic research in healthcare. Hematology, no matter how many slides, how many patients we see, I'm still learning new things every day. Yeah.
Yeah, you're right. Actually, I would say the same. Of like my friends groups, I think I can like say it with wholeheartedly that like I enjoy my job. I wake up and like I going to work. Like I'm having fun at work also. Don't get me wrong, it is tiring. Like, that there are like days that like there's a lot of like issues and then you're like kind of feeling sad when you see the patient diagnostic, you see like the history, you can see like the test result you got because you're the one who performing it, right? Like you already know.
Oh yeah.
It it's sad, it's tiring. Like sometimes you're trying to find alternative testing to help the patients. Like if the patient is like a cancer patient, there are like different genetic testings that we can perform, or like DNA sequencings, trying to narrow down what radiations, what method can we use, what chemo we can use to target this cancer. But like sometimes it's just unfortunate. Either like the patient couldn't wait until the result come back because some of these tests take really long time, like take couple weeks. Some of them almost take a month to like for the test to perform, like to finish running. So it's sad, but at the same time, you can see like how many people you help because you see like oh yeah, well this one,
Yeah.
oh yeah, his last day. I was like, cool. And then you like see the test result from the first day the patient admitted,
Oh, to when
and then like
discharged.
the
Yeah.
last day. I feel like, cool, good job.
I think
So
that's another important thing to highlight. A couple of people throughout the years, they kind of forget that there's a patient on the other end of what we're doing.
absolutely.
And like, so how do I say this? Like doctors and nurses, they have their set of patients. Like let's say in the ward, I'm not sure how many patients is assigned to one nurse or how many, depending on the specialist of doctors, how many patients they have. But for us, because we're running all of the tests that come in, like basically every patient is something coming in. But another thing I wanted to touch in on is even though our job is kind of routine, it's not monotonous because there's so much going on. And if anything, there are multiple different departments, as we explained earlier about all of the prerequisites and the different didactics in which we go through. So again, that's hematology, blood bank, chemistry. microbiology.
Yeah.
So there's different departments, and then throughout the program, you get to rotate through everything. Just to kind of, well, you have to have exposure because it helps you understand the testing
Mm-hmm.
process and look at the bigger picture of what's going on with the patient. At
Yeah.
the end of everything, you kind of only really get to work in one department, or it depends because hospitals break it down in different ways. Um, but yeah, so I always like to ask the students when they train around because we're still in a training, we both work in a training hospital.
Mm-hmm.
When they come in for the program and they move around and I get them for a certain section, I like to ask them in the beginning of the year, so do you know what department you want to work in? And they're like, oh, I don't know, or like say something. And I was like, okay, I'm gonna check in with you at the end and see like what you want to be. Um, and it's very interesting because a lot of people they come in with like their microbiology degree. So they say they want to work in micro after, and sometimes they end up in a different department.
Yeah, to
But
send them out after the training.
so Peach, when you first started, do you know what department you wanted to be in? And then talk a little bit about where you ended up after.
I know I don't want to be in blood bank.
That's surprising.
Yeah, I know like at the beginning, like I that was like the first department I trained in. I was
Uh-huh.
like, no, I'm not in blood bank. Guess what department I end up in?
Well, I know already, so go ahead and tell them what
So
department
I
did
end
you.
up in blood bank at a trauma center.
Mm, yeah, that's
Yeah, so don't say never. You never know.
yeah, right?
I end
I
up in, and actually I was, but I mean, to be like honest, by the end of the training year, I actually love blood bank.
oh,
It's
that's
just like
good.
at the beginning, it just like get thrown in there, and it was I think the criticalness of it, like the urgency of it, make me scared at the
Mm.
beginning, right? So because all the other departments, like if you want you're interested in like, how many departments there are, check out video in Blood Talks. There are like videos in different like departments, right? You can take a look. But like b- blood bank is like one of the area where it's a mistake. It's mean life or death.
Oh
If
yeah.
you transfuse the patient's wrong blood type, the patient will die like in less than 5 minutes. Incompatible blood, right? Like if and I end up working at the trauma center. So, the patient is bleeding. How long?
I
Like you really have to move fast. You're fast and accurate. Has to like get the blood out to the patient.
I
But it's really fulfilling to be able to help those, you know, patient in their like probably one of the lowest time in their life. Their life is really hanging on a thread, and like, to see them healthy, walking out the hospital with their loved ones, it's pretty nice. Yeah. What about you?
so I was a lab assistant in core lab before
Mm.
I did the training program, and then I ended up a CLS in core lab. So I was
So you
saying
already know you want it to be in core lab?
not well, yeah, I did want to be actually, but I was like, Jesus, take the wheel. Wherever there's an opening is what I'm gonna take. And I ended
Mm-mm.
up back in core lab, and I really enjoy it. In actuality, like throughout the training, blood bank scared me a lot. N- I mean, obviously because of the high risk, but also I guess high reward. But
Not
um,
really. We get paid, say the same pay,
but
but like fulfilling, I
yeah.
guess. Mm.
Um, but it was just really hard for me to wrap my head around. I think because back then the way the program was structured, over the years, a lot of people were recommending that they should start the rotation with blood bank before we reached the lecture. And so like mine didn't coincide at all, so I wasn't able to like put them together and it just
Mm-hmm.
kind of like confused me. And then for micro, I don't know if it's like because I had really bad eyesight or I wasn't wearing my glasses or both, but when my trainer was training me like how to look at the cultures, she was like, "See, it's like flat and creamy," and I'm like, "Bro, it looks
It's
white
a
to
dot.
me." Like I don't know. Um, a lot of people they, well, no, not a lot, but some people I've heard they kind of like rag on Core Lab because they think all we really do is just like run, release. But there's a lot more thought process to it, even though we're dealing with like analyzers all the time. And in actuality, like one of my favorite parts of working in Core Lab is maintaining the analyzers. Like, I don't know why, but I love when it's weekly maintenance. I love
Nice.
taking care of them. I like troubleshooting. The architects, they're my best friend and worst enemy. I've gotten to know them a lot. But yeah, like I think if I were better at math, I might have been an engineer instead, and this is about the closest as I can be to an engineer. Um, but that's basically it. So I'm pretty happy where I ended up, and it's very fulfilling to have ended up at the same hospital that I trained at. So
Mhm.
lab assistant to trainee to CLS to now sometimes teaching the students. I try to give back to the community and the hospital and school, which we're affiliated into, like kind of put them in the right direction,
Mhm.
and it's that in itself also is pretty fulfilling. You kind of instill some things in each student that like I wish I had heard before.
Oh
Um,
yeah,
yeah.
definitely.
I think that's one of the benefits of having been in a training hospital and then training as well. It's like instill good habits in the future CLS because it is a small community, guaranteed there is probably someone watching who's like, "Oh, I know them. I know where they're from." Please do
Mhm.
not comment below where we are from. But if you're watching and we know you,
Thank you. Yes, thank you for supporting, be part of the communities, and like if you have any questions, you want to see any futures video, any like topics, yeah, let us know. In this series, we will interviewing other CLSs, professionals as well as other healthcare workers to give you a broader perspective on the team effort in taking or like in a team effort in providing care to you, right? It might be a surprise to you to learn that um, a lot more going into providing healthcare and to get a person, you know, back on their feet, leaving the hospital happily with their family. You'll be surprised it's more than just doctor and nurses. So stay tuned for more video like this one before, plus the new Small Talk interview coming on your ways. So yeah, I'm looking forward to see you all back here again.
see you guys next time.
Hey.